Hey everybody, Dr. Gelman here, and today we're going to talk about why equine dentition is a critical part of performance integrity. So I'm going to share my screen to the slideshow now, and here we are. So this talk is what you need to know about equine dentition, posture, and performance. So the roadmap to the next couple of hours, we're going to cover three general topics with a lot of details in between. So first, reviewing what we know about neutral posture and understanding why the teeth are involved with it at all. Second, to learn about equine teeth, because most of us know very, very little about the horse's teeth, why they're so weird, and what they're actually doing. And finally, we'll talk about how the rest of the body gets involved in this picture. So posture, as many of you have figured out, is something that I care really deeply about. And the reason that many of our horses have problems is basically because they live with us. If you look at horses who are living in a natural environment, like these guys here, these are wild horses in the American West, and they are happily living on what looks like moon rocks, and they are all beautiful, and they are all standing up perfectly straight with their legs perpendicular to the ground, while standing on sharp rocks, having teeny tiny little feet. And you'll notice that in this family, everybody looks the same. The mama looks like the foal, looks like the yearling, looks like the youngster. There is something about living in the natural environment that always results in the same look. So you don't have to be feral in order to have this going on. In this picture, this is a vintage photograph of a shepherd from the 1920s. And so what we're looking at is a human, a dog, and a horse who spend 14 to 16 hours a day working out in the field, upright, supporting their bodies throughout that period. When you stand all day long, you do not have the energy to waste on unnecessary movement and unnecessary forces. So we see that the rider and the horse and the dog all have a tall, erect posture. These are more wild horse photos. If you look at wild horse photos of horses that are standing still, not fighting or doing something more interesting, you will always see that their legs are nearly perpendicular to the ground. Even other breeds, other species of horses stand with a vertical neutral posture. If you look at photographs of zebras or wild Przewski horses, they will all be standing like this. More feral horses, this is the default neutral posture that we see in animals when they are managing their own lifestyle. However, once you take a horse and move it into a fancy barn, this is what tends to happen. Now, this photograph is from a well-known book on horse breeds, and it's demonstrating a Arabian Morgan mix, which they call a Morab. But meanwhile, this horse is not standing with its legs perpendicular to the ground. Its head is way high in the air, and you see that the photographer has even tilted the photograph to make it look like the horse is not standing so camped under itself, because if you look at the fence and the trees in the background, you'll see that they are actually on level ground and that the photo is tilted. Here's another horse just hanging out, and this is your typical riding horse. And 9 times out of 10, if you look at a typical riding horse, they are going to be standing in some version of this, often resting a leg, often with the front and hind legs camped in underneath the body. Here's a horse waiting in a farrier shop to get shod. And you see, even though the horse is looking around, there is a lot of asymmetry in this body. The horse is not standing evenly on all 4 legs. They're weight bearing asymmetrically. And the legs are camped in. If you have as much experience looking at this as I do, then you understand how you can see that. But that horse is not standing square with vertical legs. This photograph was given to me by a student of mine who was showing me her horse back home where she lived in California and they like to ride on the beach. And I know that she gave me this snapshot to show how wonderful her life was and how wonderful a horse was riding on the beach. But I look at these photographs and I was like, oh my God, because you can go through and look at 10 to 20 different pathologies on these two horses when they should be able to stand on a great surface like that totally normally. This was a patient of mine, a hunter jumper who was having trouble with back pain. So I snapped this photograph before I started to work on him. And, you know, it just looks like your average hunter jumper, nothing very special. So 40 minutes later, after I had reset the horse's posture, this is what he looks like. Now, it doesn't even look like the same horse. Go back. This is the same horse a few minutes later. And now we see that the neck is loose and relaxed. The feet are vertical to the ground. And once the feet are vertical to the ground, you noticed how crazy long those feet look. So we got into this, of course, by Yogi caring about what the feet are doing. And we'll do some other talks about feet. But the point is that there are many influences to posture. And the most important ones are the ones that we can actually change for the horses. So Dr. Judith Shoemaker, through her clinical experience, developed what we call the postural rehabilitation intervention. And this intervention is changing the function of the horse through manual therapy. And many of you have asked, well, what do you do? And if you want to learn what we do, number one, you have to be a veterinarian, a chiropractor, or a physiotherapist. Number two, you have to spend 120 hours in training because it's not that simple. But nonetheless, what you see in these photographs is the horse before and after this manual therapy intervention. So what we've done is a cognitive and functional override to the postural control system, in this case, overriding the signals from the teeth and from the feet. So let me review what controls posture. This override will last from 3 days to 3 weeks, but eventually the proprioceptive signals from the feet and the teeth will go back to asserting themselves. So we learned in the posture and proprioception lecture about what some of the postural inputs are and which are the most important. So the ones that are most important for our having the domestic horses be the best they can be are the ones from the feet, the ground surface, the ones from the upper cervical musculature, and hopefully you can see my pointer here. And these small muscles that hold the head and neck together are just chock full of proprioceptors that are reporting about head position. And of course, the teeth and the TMJ. And that's what we're going to talk about today. So briefly, why do domestic animals have chronic postural abnormalities? Because they live with us. So when horses live with us, they are exposed to confinement, which means fences, being tied up, crashing into things, having straps and things around our head and neck. And all of the dangerous work that we do can lead to injuries in the cervical region. The second thing, as I said, was feet. And the way that the feet are managed when horses are living with us are very different with how they would be in a wild environment because they're getting less exercise and the footing is not what it would be in a normal environment with a horse out in the wild. So the humans have to manage the feet, and we humans are not as smart as God. And finally, the teeth, which is what we're talking about today. That injury and changes in diet will alter the tooth wear and the dental occlusion. And we'll be looking at lots and lots of ugly photographs like this today. So why do the teeth and the TMJ matter to jumping over a fence like this? So to put it briefly, wherever the jaw goes, the brain is sure to follow because the jaw is attached right to the skull. When you're sitting here watching it and you're not, doing anything in particular, when we are neutral, our lower jaw hangs loose. That fall is synergized by gravity. And this gives us a sense of where down is. That's very important for the postural control system. So the TMJ, which are the joints of the jaw, and the dentiovelar joints, which are the joints of the teeth, have proprioceptors that are directly wired to the postural control centers because of this important connection between the teeth, the jaw, and posture. This section is experiencing posture in your own body. So, the idea of dentition being connected to posture seems so far-fetched that I find with my clients, the way to get them to understand it is for them to feel it in their own bodies. So, the first exercise I want you to do, and you can do this seated or standing, is just gently put your hand on the back of your neck. So you should feel like you are cupping your skull on the one hand, and on the bottom of your hand, it will be like resting on the muscles of your neck. Now, just talk like I'm talking. Go blah, 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 blah. What you're going to feel under your hand is movement of muscles. Now, the reason for that is that to retain upright posture, your body is constantly feeding back to the brain about where you're moving your body parts and adapting with stability ahead of time. So if you say, I'm moving my finger, 30 milliseconds before you move that finger, your back is stabilizing for your finger going out. So the movements of the jaw are 100% felt in the body and accommodated for by the postural control system. The second exercise is a cool party trick, and this will work for 90 to 95% of you. If you do this as I instruct you and you feel nothing, you need to go to your dentist and have your TMJ checked out. So, standing as I'm standing, feet on the floor, your feet are evenly about placed with hip distance apart, and feel how your center of mass, which tends to be about your belly button, is going straight down between your two legs, and just kind of track how that feels in your body. Now you're going to do some extreme jaw manipulation. So I want everyone to stand up and do this. You really can't feel it as well in a comfy chair because you're not having any resistance to your body parts. So stand up or sit in a chair where you can feel your sits bones against the chair the way you can in the saddle. Okay, so move your jaw to one side, all the way as far as you can. Now come back to center. What you'll notice watching me, and hopefully you're going to feel in your own bodies, is that as you move your jaw to the right, I just move mine to my right, I feel that more weight is going onto my right foot than onto my left foot. But if I do it the opposite way, see how my body sways this way. And now most of my weight is on my left foot. This doesn't only work side to side, it also works front to back. And it turns out that front to back is the most important part because that is the area where a lot of horses get stuck. So if you shove your jaw way out, like this, I am tipped forward on my toes. Now, I am not doing anything. I am just letting my body stand the way it will. And if you have your jaw way under, you're going to fall back. So this is hardwired into the postural control system because your brain would very much like to keep your feet underneath it, to keep your head and its contents to coming from unceremonious contact with the planet. So what you are feeling in your bodies right now is what your horses are experiencing in their mouths. If their jaws are offset to one side, their weight is going to be offset to that side. And they have no control over it. This is what is going to happen. So hopefully now all of you are convinced that the position of your jaw really matters to how your body is controlling your posture. So let's look at how this is affected in horses in everyday life. So why do domestic horses need dentists? Again, the real answer is that they live with us, but also because horses are stupid. So if we look at horses from the beginning of time, they've been around for about 5 million years, and they originated on the grassy plains of North America. They live in a family structure of herds, and they make a living by eating grass. So when humans and horses first started interacting about 6,000 years ago, the first interactions were using the horses pretty much like we would use cows. They were providing milk, they were providing wealth, and they lived in the same ways as their nomadic cultures lived. And this is Mongolian horses on the steppes of Asia. And again, we have, note the wide open spaces, the horses living in herds and family groups, the temporary housing where the people can move to better grazing area when need be. And this is an ideal symbiotic relationship for horses and humans. But then the humans decided that horses would be useful for war. So once you go to using horses for a situation where they have to go away from home, you're dealing with a lot of complications. So for one, they are not managing their own hoof care, and the invention of farriery had to happen. So the humans need to find that the places where the horses are walking when they're on a military campaign, they may wear the hooves faster than they would if they were on their meadow. So that was how horseshoes were invented. But the other big change is diet. So if you are going from here to there and traveling 50, 80 miles a day, there's not enough time to eat. So remember that this is how horses are managing their life. They are essentially eating all day long. Horses eat from 18 to 20 hours a day in a natural environment. If you are on the march, you don't get to eat. Therefore, the humans have to provide you food for you. And that's how horses started eating concentrated grains, because that was something that the army could carry with them. And it's not necessarily something that a horse would have a lot of access to in a natural environment. So this is the natural way that horses spend their time. So it's the most natural behavior for horses, but it's also how they're getting their food. They are eating the grass that's growing, and that grass will be changing at different times a year, and they will always be doing it from standing up with putting their heads on the ground, because that's where the food comes. But our modern horses are eating pre-cut forage. So hay is essentially, you take the grass, you cut it down, you now no longer have the roots, which provide a certain kind of abrasion in the horse's diet, and you're only eating the part that's already been cut and ready to go. And it's dried, and it's harder than, let's say, spring grass. And then you're feeding the horses grain, and horses who live in barns often get grain every day. And this is not something that would happen in a natural environment. So all of this is going to alter the tooth wear. If you're in a natural environment, when the winter came, you would be digging down in the snow and eating the little green shoots that are left under the snow and pulling out the roots. In the spring, you would be eating the rich, soft grass. In the summer, the grass would get hard. And in the fall, there would be grains and mature seeds that had grown with it. So the seasonal variation in the food would do a lot to help manage how the horse's teeth reacted. Now, why does this matter for the teeth changing shape? And this is, we're going to go into this in more detail, but essentially, if you eat for 20 hours a day, your teeth are going to wear away. So horses have this wonderful tooth design where as they wear away their teeth, more tooth erupts from inside their skull. And we'll look at that in detail. So the last thing we want to look at is the position of eating in a normal horse. So we're looking at these horses who are grazing because food always comes on the ground, and their heads are always fully extended down. Their heads and necks are extended down. But when horses live with us, they have a convenience for the humans, which is eating from hay nets, eating from food buckets. It's a lot more convenient for the humans. They waste less food if they have their hay up high. Now, one of the reasons that this creates a problem for the horses is that our jaw position changes if our head is up and down. And you can feel this in your own jaw. So if you tip your head up, you'll find that your jaw pulls back. And if you tip your head down, your jaw falls below. So the places in the molars that are receiving more wear will change when a horse eats pre-cut forage in a situation above the ground. The other thing that's important about the way horses are eating in a domestic environment is that the sympathetic tone is different with a raised head, an alert head, than it is with grazing from the ground. When horses graze from the ground, they're in a safe zone for rest and digest, which prioritizes the parasympathetic nervous system. Parasympathetic nervous system is the baseline from which we perform most of our activities. Sympathetic nervous system is alert, watching out for danger, and being ready for fight or flight. So in horses, that is an alert high head position. So when a horse has an alert head position and they're eating, you have a mismatch between the levels of autonomic tone between the sympathetic nervous system and the parasympathetic nervous system. And this is a big contribution to why many racehorses have ulcers, because they are trying to rest and digest while their heads are outside of the stall and looking for their herd members and eating hay out of hay nets. So what are the traditional observations for thinking that a horse has dental problems? So some of them are similar to that in humans. You smell what smells like a rotting breath. Horses can lose weight. You can see head tossing and head shyness from pain. And there's something called quitting, which not everybody has seen, but essentially when a horse is not chewing their food well, they kind of move it around in their mouth and end up dropping balls of half masticated food. Some horses dip their hay in water before eating it to soften it up if they can't chew well. And sometimes you just see the food dropped on the ground. Facial swelling if you have an abscess, and that's the same in humans. And unmasticated and undigested food and feces is another thing that you can observe. So these are the traditional ways that somebody says, yeah, you better get the dentist in. However, what you're going to learn today is that there are a lot of other things that are related to having a malocclusion in the mouth that is affecting how your postural control system is organizing your body. And that can be performance problems, stiffness, either to one side or both sides, unwillingness to pick up a lead, inability to maintain a frame that you're asking them to do for jumping or for dressage, uneven gaiting, and asymmetrical or uneven loading and stance. So let's look at an example. So here's this horse who is standing in a stall, and we're going to first look at the teeth. And you see that the teeth are not quite matching up. So how should teeth match up? Horses' teeth, if you can look at the front, they should be meeting right side to side, where the front and the bottom teeth come together. So what we see in this guy is that there is both a twist and change in the angle that they're meeting. And this is a complex pattern that is very common in horses. So what we're seeing in this photo here is, number one, that the lower jaw is hanging off to the side, to the left side of the horse, okay? And if we look closely, we can look at where the center of the upper jaw is, which is the green arrow, and the center of the lower jaw, and they are offset by a good ½ inch. So then if you look at the horse and how he stands, what we see is that he's holding his head to the right and weighting to the left. So he is standing harder on his left front foot, and he's counterbalancing with his head and neck. And he's got a really twisted, dysfunctional posture that is related to the pattern that we see just in the front teeth of the horse. So remember this girl, the one that you saw standing there? So this horse is a great example of an up foot, down foot, an uneven hoof pattern. So if you look here, you see how the difference between the height of this heel and the height of the right heel. So this is this horse's down foot, which means it's bearing more weight. And this is the up foot, which means that it has less weight bearing and is growing faster and therefore has a higher heel height. So this pattern of a more weighted foot and a more unweighted foot is typically seen with horses who have incisor patterns like this. Because remember how when you put your jaw to the side, and you can even feel this in your chair, if you put your jaw to the side like this, you will feel more weight on that sits bone where the jaw is. So the horse who has a abnormal weight bearing with more weight on the left front than the right front, that will come from the jaw. I'm not saying that in this horse it particularly came from there, but it's one of the causes of asymmetrical weight bearing. So let's look at what is normal and what's abnormal in equine teeth. And I want to thank a bunch of people for these images. My partner and colleague, Dr. Judith Shoemaker, and Lee Follett, who is a dentist who's worked a lot with the postural rehab program, and Tony Basile and Andy Dibbern, who are dentists who trained Lee. So they have accumulated a lot of these over the years. This picture of the horse going like that out to the side, we all think it's really cute when they do that. I mean, it looks funny and it makes us laugh. However, it's very often a sign that the horse is struggling to reset their TMJ. So what is the difference between horse teeth and human teeth? We all pretty much have a good sense of what our teeth look like because we're taken to the dentist when we're little. And we know that we have an enamel coating and that is protecting our feet. And that if we get a cavity, that we have a hole in our enamel coating and then we have to get it filled to protect it. The inside of our teeth is soft, and if the inside of the teeth gets exposed to the outside, it hurts, you get a toothache, it's a problem. And when we chew, we tend to chew up and down. Now, horse teeth are remarkably different. Their teeth are really long, and they have, instead of the enamel being on the outside, the enamel is on the inside. It is making ridges throughout the tooth. And in between these enamel ridges are cementum, dentum, and pulp, and they're vertically oriented throughout the tooth. And horses chew their food because they're eating grass all day long and it requires a lot of chewing. They chew in a lateral and a circular motion. So this is what a horse tooth looks like from the bottom. And you can see those little holes are where the nerves are fed. And these are the enamel ridges, and that's what's grinding the food. And in a living horse, in between these enamel ridges will all be stained like kind of a dark green color from their hay and their grass. And that is the dentum and cementum, and it's softer than the enamel ridges. And all three of these substances get worn away as the horse chews all day long. So when the tooth is worn from the hard substances in the grass contains silica, and also when horses are eating in a natural environment, there will be bits of soil in the grass. So the teeth will wear away, and the way that the animals who eat this way, the cows and horses, all kinds of animals who are herbivores, they have more tooth than they need, and it's sitting in their jaw. So here is a horse jaw that's been cut away, and what you see is that the tooth has these long, long roots that are underneath where the gums. So the gums are coming up to about here, and as the tooth wears away, the reason that we have those proprioceptors in the dental-alveolar joint is to perceive how well the upper and lower teeth are meeting. And if there is loss of tooth through wear, more tooth will erupt out to meet it. So one of the things that most of us know about managing horses is that they need floating. What's floating? Floating is removing sharp points. And why do horses get sharp points? The reason is that their bottom jaw is narrower than their upper jaw. So we're looking at a horse skull from the front, and you see here is the upper tooth, and here, where you can't even see them, are the lower tooth. And when the jaw is in a neutral position, i.e. closed with the front teeth meeting, the molars are not touching at all. They're not meeting each other. So in order for the molars to meet, the horse has to bring its jaw out to the side, create contact between the molars, and then grind it across. So that grinding motion creates a sharp edge on one side of the upper teeth and on the inside of the lower teeth. So the upper teeth have sharp points on the cheek side, and the lower teeth have sharp points on the tongue side. And this is completely normal for horses. However, what's not normal for horses is to wear bridles and bits. The bridles and the bits are forcing the soft parts of the cheek and the tongue into contact with these sharp points. Also, horses who lived in a natural environment would be eating different foodstuffs throughout the year, and they would be able to knock off these sharp points because of the variety in the hardness of what they were eating. So domestic horses need to have these sharp points removed by filing, and this is the very simplest kind of dentistry, is simply taking a file and removing those sharp points before they make holes into the side of the mouth the way this horse has. So that's the basics of what an adult horse is like. And we need to look back on how horses' teeth develop from childhood in order to understand what can go wrong. So going back to the young horse, if any of you have kids, you know that the teeth come in a certain order. So first they get the front lower teeth, and then they get the upper teeth in the front, and they don't start getting the molars for chewing until they're a little older. It's the same thing in horses. They have the deciduous, or teeth that get shed, the baby teeth, that come in very early. I think the first teeth are 6 days and the second teeth are 6 weeks. And those teeth are used throughout their childhood and get replaced by the adult teeth at the appropriate time. And that time is really predictable. So if you look in the jaw of a juvenile horse, so this horse is looking at the teeth, it's going to be something like 3 years old. And what we see in this jaw is the adult teeth that are here and the very little that's left of the juvenile premolars here. So you see this short tooth that's sitting on top of the longer tooth. These are called caps, casually in horse barns. So if you've ever been in a racing stable, they talk about removing the caps. The caps are naturally shed as the molar pushes through. You can see it even more dramatically in the upper teeth because the lower teeth always come in before the upper teeth. So here, the cap is more long. Here, it's more worn away. And you see that 2 of the 3 molars have come in and 1 still has not erupted into use. So these are the deciduous teeth being shed. So we know exactly when these teeth should be coming in and when they should be leaving. So the first incisor, the center teeth, they should be present within the first week. The second incisors, the middle teeth, should be there within 6 weeks, and the third incisors within 6 months. The permanent teeth come in a year apart in the incisors. So we have 2.5, 3.5, 4.5 years. In male horses, we have the canine or wolf tooth. And then we have, the first premolars in wolf tooth. The males have the canines. And then we have the cheek teeth, which are the chewing teeth. And the premolars come in starting at 2.5 years. And finally, the last molar comes in and comes into use at around 4.5 years old. So these are a critical thing to notice, that a horse's dentition is not complete until they're 4.5 years old. What this means for our horses is that most of us are just starting to train the horses maybe between 3-4 years old. Racehorses start as early as 2.5 years. All those racehorses have only their baby teeth in their mouths. By the time the full dentition is in the mouth, most racehorses have ended their careers. Most racehorses don't race past 4 or 5 years old. And once the full dentition is there, it often takes some time for dental asymmetries to become exaggerated enough to really affect performance. Because remember, the teeth are erupting only as fast as they're wearing down. And in domestic horses, if they're only eating hay, their teeth are actually wearing slower than a horse who had a natural environment with real grass and real hay to eat, and they could eat all day long. So the eruption rate will always match what the wear rate is. And the reason I'm mentioning this is that typically, like if you have a young horse who, let's say, retired from the racetrack, off the track thoroughbred, those guys, they do great when they're like 5-6 years old, and very often they start having serious problems. Sometimes they've got hock arthritis, sometimes they've got other lameness, they've got back pain. All of those things seem to start setting in when they're like 9 or 10. And it's not a mystery when you look at how important teeth are to performance. So this mouth was one of my patients. This was a racetrack pony. So a pony is a racehorse who is used to keep the performing racehorses calm as they go in between the barns and the track. So they just ride alongside them and they help the horse feel like they're part of a herd. So this horse was a former racehorse who had a very good temperament, and so the trainer kept him to use as a pony. And he always, I was always treating him for problems. He had neck pain, he had back pain, and we finally got Lee Follett, who's my dentist, to come out and look for him. And this is what his teeth looked like on both sides. And you can see here that there is a huge hook hanging down in the front, and then a huge, cavity back in there. And then there's uneven wearing where the teeth are in such dramatic ridges up and down that this horse is unable to move his jaw in a forward to back direction. So these uneven molars, which are matched by molars on the bottom, they're preventing the front to back movement of the circular movement of the chewing cycle. So if the horse is supposed to chew front to back, side to side in a circle, if you can't move front to back because the teeth have gotten in the way, then you're only moving side to side, and that's how those grooves got worn so deep and the hooks so long. So in older horses, we have different kinds of problems. One thing to realize is that the eruption rate will vary with the age of the horse. The young horse, the mature horse, will erupt quite a bit. They will have 5 to 8 millimeters per year, so almost a half an inch of eruption. And this explains why things can go really bad really quickly with horses in that adult age grade, your 7, 8-year-old horse. Once the horse reaches maturity, the eruption slows down a lot. So for the teens of the horse, those are good years, and they will have enough eruption to serve their needs and for you to make changes, but it won't be changing as rapidly. And then by the time the horse gets to be a senior, the eruption slows way down. And the older horse, the horse who's over 25, 30, 35, there's almost nothing left to their teeth. And those horses are going to need help by giving them soft food to eat, like soaked hay cubes. When there's no more root left to erupt, then the pulp cavities just fill in with dentin, which is rather soft. So this is what the reserve root length is in the skull of the horse at different ages. The 3-year-old horse has 2 or 3 inches of tooth left. A 25-year-old horse has barely anything left and is about to expire. And what you see on the right, this is the really aged horse who just has a little nub that's sitting there in his mouth. And that horse will very often have difficulty getting enough food masticated to keep their weight up. So the occlusal equilibration goals of the geriatric horse have to be approached very carefully. You need to be realistic about the eruption rate and balance your equilibration goals with how much tooth is left to make them and how often you can modify them, and be ready for alternative feed so that they can keep their weight. So what is a normal occlusion and what is a problematic occlusion? On the left, upper left, what you see is the skull of a wild horse that Lee recovered from the desert of Las Vegas. And if you look at this arcade of molars, what you see is that all the teeth are the same height and they're all lined up very well. Now, you do see some sharp points, but those aren't a problem for the horse because it's not wearing a halter or a bridle. And on the bottom teeth, the same thing. The teeth are very similar heights. They're all lined up. And what you can see here is very gentle ridges. And those ridges allow an uneven surface, almost like a washboard surface, that enable the food to get ground up. So as the grind is going around like that, there can be an active part of the grinding surface and a part where the very small particles will then feed back into the mouth and be able to be swallowed. By contrast, this is the skull of a domestic horse, and you see that this horse has what's called an extreme wave mouth. So instead of having a straight across, same height of tooth, we have teeth that are really long on top here, short on the bottom here, and then here we have long and short up here. And you can see in particular, right there, you see that mottled looking appearance to the bone? That is what happens when the bottom teeth are pushing up too hard against the top teeth. It actually starts making bone resorb in the tooth socket, and eventually they can lose the tooth. So the teeth are only one part of the stomatognathing system. The stomatognathing system is really critical for the body because it's what gets us our food. So it involves the skull and the teeth, a whole bunch of muscles. So we have the muscles of mastication, and we have the strap muscles that are controlling head position, the hyoid bone and the hyoid muscles which control the trunk position. We have the muscles of the head and neck and the nuchal ligament and how that's attached to the withers here. And all of those are working together to allow the horse to spend 20 hours a day grazing. And that is what's normal for a horse, to be chewing for 20 hours a day. So chewing is as complex a process as locomotion is. The process of locomotion involves a complex interaction of many different muscles and many different compartments of muscles in order to achieve these different movements. And I'm going to demonstrate this with my skull, but for you to think about it theoretically beforehand, first you need to open your mouth, and gravity helps with that. The jaw will fall open if you don't hold it closed. Then you need to close the jaw, and in the horse, this is controlled by the temporalis muscle and a certain part of the cheek muscle that's right by the TMJ. Then you need, if you're a horse, to bring your jaw over to the side so that your molar arcades are meeting. And then you need to grind. And depending on which side that you're grinding, you have the working side and the balancing side. And all of these muscles are involved with controlling it minutely. So the body can control how much pressure each tooth is putting onto the grind. And the reason this is so important is that you don't want to break a tooth. In the wild, breaking a tooth can lead to a abscess and an infection right near the brain, and that spells out death for a horse. So a really high priority for the stomatic-gnathic system is to make sure that the teeth are safe and they're protected and they don't break. So you don't want to chew on a rock and chew on it as hard as you can. So let's look at what this looks like.
Let me introduce you to Daisy. Now, not every family has a horse skull, but my husband is a veterinary medical illustrator. And about 15 years ago, he said, well, why don't we get a horse skull? I need it for a project. So I called up Skulls Unlimited, was the world's premier supplier of skulls, and said, what do you got in a horse skull? So they took a couple of pictures, and I wanted a really beautiful and perfect one because I wanted it for teaching. What I got was pretty surprising, and it's even better for teaching. So what I'm going to show you with Daisy's skull today is basically how the head is put together and what the consequences are for chewing. Now, the first thing to notice, and we looked at this in pictures before, is that the lower jaw is much narrower than the upper jaw. So you see how the bottom teeth are not matching up to the top teeth, right? So what that means is that when the horse needs to chew, they need to bring their teeth into occlusion together. So if in neutral, when the front and lower jaw are meeting correctly, they don't meet, then they have to bring their teeth to the side in order to chew. So what does chewing involve? Let's go over the muscles of mastication. So we're looking at the skull, and there are certain landmarks that you can see in the living horse. So the eye is obviously one of them. From the eye up to the back of the skull, the forehead of the horse is all covered with the temporalis muscle. The temporalis muscle is a power muscle for closing the jaw. And the way that it does that is that this tongue sticking up, that is part of the mandible. So that is called the ramus of the mandible. And this is the connection, the main connection between the mandible and the skull. So the temporalis muscle, rest this on the ground here, temporalis muscle grabs around and is attached around this ramus of the mandible. And what it can do is, watch the way that bone moves. If the jaw is open, gets a little higher. If the jaw is open, if you pull that part back, do it from the side, if you pull that part back, it closes the jaw. So the first part of chewing is to let the jaw open with gravity, just fall open. Then you need to use the power muscle, this temporalis, which is sitting in here, making the forehead of the horse, to pull this back and close the mouth. So while the jaw has been opened, then the two big powerful cheek muscles are positioning the teeth for chewing. So this here is equivalent to the line of your own jaw. And there are two big muscles that are doing the work of the chewing other than closing the jaw. And one of them is on the outside. So this muscle called the masseter fills in everything from the crest of the horse's face down to the jawline. Big muscle, many layers. But also on the inside, there's a muscle that's just as big that you can't see and you can barely feel. Like if you go on the inside here, maybe you'll feel it a little bit, but not much. You'll mostly feel the bone. So this muscle, the pterygoid muscle, the medial pterygoid, takes up all of this space on the inside. Between the two of them, they create all of the power and force and movements that are needed to chew. So, first part of the chewing cycle, the jaw drops with respect to gravity. Second part, the temporalis closes the jaw with the teeth brought into occlusion. So you see how now the front is offset, and now you go across the teeth to chew like that. If you watch your horse chew, like let's say, you bring your horse out to graze and just keep an eye on them, what you will find is that they will spend maybe 10, 15 minutes chewing on one side of their mouth and then switch to the other side of their mouth. If they don't switch, there's something wrong with them that they can't chew on both sides of their mouth. So remember, you can't chew on both sides simultaneously when you're a horse because of how narrow the jaw is compared to the top side. So you switch between the two of them. The sharp points, so remember we talked a little bit about sharp points? The sharp points are what most of you know about dentistry. They are the bits here on the outside of the upper teeth and on the inside of the lower teeth. And this horse has some pretty good ones. And I'll show you some photographs of them later that are sharper. So that comes because of the angle at which they're chewing. So if you look at the way that these teeth are meeting, they are sliding off like this. And what that means is that the edges can get sharp. The last thing we want to look at on this is the temporomandibular joint, because when we're looking at this chewing cycle, so remember here we are, we're chewing, we're chewing, we're chewing. The parts of the system that are guiding it and controlling it are the front teeth and the two temporomandibular joints. Now the temporomandibular joint is a very complex joint because it needs to have a variety of behaviors. So again, our teeth are different than horses' teeth, but essentially we need up and down, open and close, we need side to side, and we need front to back. So the way we accomplish it is to have this joint, which is like a bar. You see that very well? There's a bar that fits into a cup. So this allows all of this different movement. Now in this skull, you'll see how there's kind of empty space in here. So there is no empty space in living animals. It's all filled with stuff. What it's filled with in the living horse is something called the temporomandibular disc. And I'm going to show you photographs of that. The temporomandibular disc fits in between the mandibular side of the TMJ and the maxillar side of the TMJ, and it makes all of the parts fit together beautifully and congruently. So it's serving a mechanical purpose. It's allowing this joint to have complex movements without having places where there's too much pressure on the bone. But also, as a joint, it has a joint capsule. So the joint capsule is going 360 degrees around this, and the joint capsule is very dense in proprioceptors, as is the disc itself. So everything that the horse is perceiving about what's happening while they're chewing is reported to the mechanoreceptors here and allows the animal to change the pressure on the fly to adapt to different foods or to avoid chewing on a stone where it might break a tooth. All of these things are being fed back to the brain from the TMJ disc. There are also proprioceptors along here in all of the sockets of each tooth. Those are called the dentoalveolar joints. So the TMJ disc, which is sitting between each of these TMJ joints, its position is reporting back to the brain about what the jaw is doing. And remember, what the jaw is doing is important for how the feet are balancing the body. The position of the TMJ disc within the joint is controlled by a tiny little muscle sitting right here in a really obscure place where you can't see it or get to it at all. It's called the lateral pterygoid muscle. I don't know why. The lateral pterygoid muscle is the positioner for the TMJ disc and therefore the jaw. So when a horse has chronic asymmetries in their dentition that pull the jaw to the side, those lateral pterygoid muscles, which are just right here below the brain, are working really hard to try to accommodate all of those changes in position in a way. And that is why horses who have malocclusions often are painful in the musculature surrounding this joint. So in your horse, if you go to the outside of the eye and straight up from the line of the jaw, that's where you're going to find the TMJ. And you'll see there's bumps sticking out. This is sticking out right there. So if you kind of like put your hand around it, I can't do it from this angle, what I often do is I'll put my thumb on top and my things on the bottle, and I'll just kind of twist it counterclockwise and clockwise to feel what the horse's reaction is. So as you're doing this, look at their eye. If nothing happens, nothing happens. They could pull away when you put a little pressure there. They could get a really glassy look in their eye, like I'm in Maui, I'm in Maui, I'm in Maui. And that's a significant thing to understand about how stressed these muscles are that are controlling the TMJ. Okay, let's go back to the slideshow and look at what this disc looks like.
Okay, so now we're going to go from imagining the TMJ disc in between the parts of the TMJ joint, temporomandibular joint, and actually seeing what sits in there. And these are photographs of my personal TMJ disc, which unfortunately got lost in one of my freezer transfers. But this disc is shaped like the contour of the joint surface, which is to say it's long and it has a rounded surface, and the joint surface is made from fibrocartilage, which allows rapid remodeling to accommodate whatever the jaw is doing, and it's surrounded by a joint capsule. And this is really difficult to remove, let me tell you. So the TMJ disc is different on each side because the part of the jaw on top, the top part of the joint is very different than the bottom. So what you see here is my skull with that TMJ disc inserted into it. And this is just a random disc that I took out of another specimen. It was not this horse's TMJ, but already you can see pretty nicely what that is doing for that joint. So it creates a separation in there, and it's holding these parts apart, and the capsule is going to be along here, which you can actually feel in the living horse. And then if you were looking straight through, we would be looking at the lateral pterygoid muscle. And I think I took that slide out because I didn't want to gross people out by bloody pictures. But essentially, that muscle is sitting on the far side of the joint, right in the center of the body, and that is controlling the position of the TMJ disc, moving it from place to place and making sure that the jaw and the disc are in the correct position for protecting and function during chewing. So these are the parts of the horse that are working normally all the time. So then, what could go wrong? Since living with humans has created all these problems for horses, it's also up to us to try to fix them. A lot of people have their horses' teeth seen to by their regular general practice vets. And that's kind of crazy, because would you go to your family doctor if you had a toothache or a broken tooth or a cavity? Of course not. You would go to somebody who had exclusive training in teeth. So To have a specialist who's knowledgeable is really important in order to have the teeth taken care of the way they should be. In vet school, we got almost zero education on teeth. There was no formal education on doing anything for equine dental maintenance. And I asked my ambulatory professor if I could make an appointment for her to float my horse. And she goes, no, I'm not going to make an appointment, but you're going to come with me and I'll show you how to do it. So she comes to my barn and she's got a bucket with 2 floats in it. She fills the bucket and she takes the angled float and says, listen to this. It goes, shoom, shoom, shoom. She goes, you hear that? Okay, now you do it. And then she like shows me how to get the points on the lower teeth. And then she smiles at me and says, okay, you're licensed to float. I mean, literally, that's all I learned about doing teeth, and I didn't know any better. So it's really important that you need an occlusal specialist for equine dentistry, not just someone as dumb as me about teeth who thought that all you had to do was float them. So the dentistry for horses isn't a trivial job because it turns out that aside from moving, chewing is the most important job that a horse has. And normally they will be chewing 16 to 18 hours a day. So there are lots of structures involved with it. There's the teeth, but there's also the muscles and the ligaments and the nerves and all that. And as we're learning, the poor occlusion affects eating, posture, and locomotion. We veterinarians are not educated in occlusal equilibration. Therefore, we are usually not competent to supply it. The goal of occlusal equilibration is to restore the normal movement of the mouth so that mastication can take place in a functional and normal way. So horses, if they're grazing for 16 to 20 hours a day, they're going to be doing many thousands of chews every single day. So it's absolutely critical that chewing is a function that can happen with a minimal amount of energetic cost and without damage to the structures, because it's going over again and again and again. Functional occlusion is determined by the guidance of the front teeth and the hind teeth and TMJ in horses. And the relationship between the front teeth and the TMJ needs to be congruent. A way you can feel this in yourself is that if you close your mouth and clamp your teeth together like this, when you slide your teeth to the side, as if you're doing a lateral excursion for chewing, the way a horse does, at a certain point, the contact with the molars will separate your front teeth. So now my front teeth are meeting. When I go to the side, it opens my mouth. So in horses, this is called excursion to molar contact. It's how far can the jaw go over before the incisors are separated. And this becomes an important measure of how symmetrical the function of the mouth is. So we want a congruent relationship between how the front teeth meet and how the TMJ and hind teeth meet. So if you're looking at a skull, which is fairly easy, imagine a credit card held between the horse's teeth and creating a plane that goes all the way back. You want that plane to intersect the TMJ. In that way, when the TMJ, so here's the front teeth and the TMJ, when they're moving, they are all talking to each other in a symmetrical way. Now, when we look at Daisy, my skull, we see something quite different. So on this side, you see how I've put the line between the incisor plane, that is how the front teeth are meeting, and it comes out somewhere along the middle of her nose. So what we're experiencing in this horse is that she has a significant overjet. So you see how The front teeth here are hanging way over the bottom teeth. That's called an overjet or an overbite. And most horses who have this condition have an abnormal compensatory posture where they're camped in. And this jaw position sets it up. And we see on this particular horse, here's a front view, and we see that she doesn't just have an overjet, she has an overjet and a really severe diagonal. So we see that the teeth here are really short and the teeth here are really long. So this creates a trapezoidal distortion in the incisors, but that distortion also gets echoed in the molars and in the body. So here is a picture of another horse who has a diagonal occlusion. And with a diagonal occlusion, you want to look for how much is the jaw offset from the rest of the head. So we look at where the center teeth are. So in this mouth, here's the corner tooth, the middle tooth, the two center teeth, and here is the center midline of the jaw, and here is the center midline of the maxilla, or the rest of the head. And we see that they're almost a complete tooth width apart from each other. And its jaw is sticking out here on the lower side and is sticking out here on the upper side. On the right, you see this same horse after modification was made to the teeth using occlusal equilibration so that the teeth are now functionally even side to side and not catching front to back. So if we look at that from a side view, this horse has what's more of a just a straightforward overjet. So we see how the front teeth are overhanging on top over the bottom, but the plane of occlusion is pretty level, and that can be fixed by taking some tooth off the lower end so that the front to back occlusion is restored. So the most important thing is restoring the front to back occlusion. So here is the after shot for that horse, and you see what the skilled dentist has done is slightly reduced the lower tooth so that the upper tooth doesn't catch on it, and brought back as much as possible to minimize the overjet. And here we see that mouth in a much more functional way. One of the other common malocclusions of the incisors is a ventral curvature, where you see that it is higher on the lower outsides and lower in the center. And here on the right, we see that that has been modified to be more even. And then the diagonal or wedge mouth, which again is a very common pathology that we see in horses who have a great deal of asymmetry. And in many cases, the diagonal mouth problems, the trapezoidal distortion in the skull, is the initiating causes of the trapezoidal distortions in the body, in the fascia, and in the feet. Sometimes it's the other way around. Sometimes distortion in the feet leads to distortion in the skull. But what typically happens is that skull distortion happens while the horse is a foal and they're playing around with their buddies and they get kicked in the face, and something gets squished in and the face is no longer symmetrical, and everything else that happens starts from there. So again, we see a line that is identifying on the left side where the center midline is of the upper arcade, and on the bottom, this is the center of the upper arcade, of the lower arcade, and now in the after shot, we see that they've been realigned. So when you have a situation where you have an overjet, so imagine this, if this is our horse, let's see if you got enough contrast there. Here's our horse, and this is the normal, but then you have an overjet. It's not just the incisors that are involved. So here, my little horsey model there, here's the incisors, but if my overjet is out here, what that also means is that the upper molars are overhanging the lower molars. And that's how you get our next malocclusion, the hook. So if that upper molar is not opposed completely by the lower molar, then the front of the tooth will keep on erupting and not wear away. And you have a blockage of front to back movement. And when you can't move front to back, then the horse only chews side to side, and these patterns become more and more ingrained. So the most common place to see this pathology is on the first tooth. But if you can imagine, if this is your occlusion and the first tooth is overhanging like that, then the bottom last tooth is also going to have no opposition and going to get out of whack. So the rostral hooks, here you see another version of it, and you see the long hook right here in the front, and here is with the hook taken off. But then in the back, you have another one, a caudal hook. And the rostral hook will be on the upper arcade, and the caudal hook will be on the lower arcade. And you can see the instrument behind here, and you see a huge, big spike there. And that big spike is digging into the horse's jaw every time they close their mouth. So in the after picture here, you see the spike has been removed. Steps are a length discrepancy between the teeth, and you usually see this more often in the hind teeth. And remember I was saying how the pre-cut forage, the hay, can create some problems? One of the problems is that the hay is preferentially chewed in the front of the mouth, so the rear of the mouth, these teeth here, are not getting as much chewing and not wearing away as quickly. So this is a problem that is seen most commonly in horses who eat only hay. Then you can have ramps on the lower teeth when you have a different kind of incisor malocclusion. But again, whenever you have a ramp or a hook, it means that there is a lack of perfect alignment between the front, the top and bottom arcade. And then we have complicated mouths that have all kinds of things going on. And typically, we often see a step here at the number 10 tooth, and that's because that tooth in the middle of the mouth is the first molar to come in, and it tends to be the most powerful tooth in the mouth because it has the longest root. So it's very common that we see a step that's occurring right about here. And then we have what's called excessive transverse ridging. So you see here, there's a scalloped appearance, and that is another thing that's preventing the smooth movement front to back. A wave mouth is something that we see quite often in mature horses. And in this case, we have that strong tooth here, which is impinging upon the weaker tooth up here and causing loss of bone and periodontal disease. And by contrast, here, these teeth are overpowering this teeth. So to fix a pattern like this, so once you have this ingrained pattern, you can't move front to back because it's locked in place. You only move side to side, and then the side to side makes it worse. So the skilled dentist has to very carefully remove the surface of the teeth a little bit here and there to encourage some teeth to erupt more and some teeth to erupt less. And you can ameliorate this condition over time with skill. So what does a normal arcade look like? A normal arcade is flat and can chew in any direction without getting stuck. This skull belongs to my friend Kate Kennedy, and it is the skull of a juvenile Przewalski's horse. And you see here that it doesn't even have all its front teeth. So some of these may be premolars, but when you look at these teeth, they look like a work of art. Every single one is scalloped in a really smooth, particular way, and they are just beautiful and smooth and straight. So occlusal equilibration, by definition, is the elimination of defective occlusal contacts that interfere with the function of the temporomandibular joints. So temporomandibular joints are guiding the mastication cycles. The horse has to chew many, many thousands of times a day. So when the teeth are equilibrated, the chewing can go on either side of the mouth without any kind of issues. So what could go wrong? There's a lot of what we call tooth fairies out there. There are some dentists who have a lot of education in dentistry, veterinarians who have education in dentistry, and there are non-veterinarians who have a lot of education in dentistry. So how do you choose the right practitioner for your horse? If it were me, I would choose by the one who has the most training and experience. And like many professions like farriery that involve manual skills, I believe the only way to truly learn it is through an apprenticeship. So you want to find a dentist who has apprenticed through hopefully more than one master and has learned a lot of techniques and has the trust of knowledgeable veterinarians. So what can happen when things go wrong? Well, first, there's the dentistry where they don't do anything. So they float the sharp points, but they don't change any of the defective contacts. So the horse still has restricted AP movement and still has persistent asymmetries in the dentition. Then there's the vet with a power float, who, as Dr. Shoemaker says, giving a vet a power float can be like giving a monkey an Uzi. So if you just go in there indiscriminately and smooth out the teeth so that they are looking like the handle of a broomstick, then you not only have no chewing surface left because you've flattened out all of the occlusal contacts, and you also have changed something called the vertical dimension of occlusion. So your muscles adapt to the position that your teeth are when they're occluded, which is closed, like that. Your muscles know where that distance is. So if you come in there with a power tool indiscriminately and just take 2 millimeters off everything, no matter what, you're suddenly going to have a gap between the teeth. So not only will you not be able to chew, but the muscle adaptations that you've had that your body has known how to use suddenly will be dysfunctional and will have to change. So a horse who has been taken away the vertical dimension of occlusion, how long their length of muscle habitually is for chewing, they struggle with chewing, they have muscle spasm, and they have pain. And then the third common mistake is that many veterinarians will work on the molars, but ignore the incisors with the idea that they should do no harm. If the incisors are long, but you've just removed surface from the cheek teeth, then the horse can't put his teeth together because the incisors are too long and are interfering with the anterior guidance of the stroke. So you need to have somebody who understands how the mouth functions work on your horse's teeth. An accurate occlusal equilibration looks at the whole horse, not just the funky teeth. You need to take the age of the horse and the amount of eruption that you can anticipate into account before making a treatment plan. So let's say you've got a 7-year-old horse who've got a train wreck of a mouth, but their teeth are erupting really fast. So you can do a change to their mouth 3 times in a year. Every 4 months, come in, take a little bit. So by making the change subtle, but each time making the mouth more functional and more able to do its full range of motion, you can enact a really stable mouth over the course of about 18 months. You need to use the principles of functional occlusion, i.e. knowing how the anterior and posterior guidance work together, the vertical dimension of occlusion, using centric relationship of the jaw to relate the incisors and cheek teeth together because they're all part of the same skull. They all have to work together. And you need to balance the conservation of the teeth with correction of occlusion and posture. So what does this look like? The steps of an accurate occlusal equilibration, and in this photo you have Dr. Shoemaker and Lee Follett, and he always starts the equilibration with the incisors. So he's going to look at the mouth, check it out, sedate the horse. The horse has to be sedated because you cannot ask a horse to say, grind a little bit and tell me if it feels funny. You have to have enough relaxation in the jaw so that the practitioner can move the jaw around and feel for occlusal contact. So leveling the incisors and eliminating any AP restriction in the incisors. And that's what he's doing in here. He has a power burr that he's taking just tiny bits off the front teeth, the bottom and the top, in order for the mouth to move smoothly front to back, side to side. He's already checked to see how whether there is a mismatch in the center of the teeth in the horse's habit, and is there a difference between the excursion to molar contact side to side, which tells us how the function of the TMJ has been stuck. So he's going to eliminate the occlusal defects in the molars while the horse is sitting on a table, which is placing the TMJ right in the center. He's going to restore the movement of the arcades, and then when all of that is done to his best ability, the rough articulation, then he's going to take all the hardware off the horse, so no mouth speculum, no table, and use his hands to grind the jaw back and forth in the positions that the horse is going to use so the horse has to be sedated in order for him to do this. So he's going to go like, yeah. And he both feels and listens for any kind of place where there's a stickiness. And he can find just the tiniest little thing in order to take down any prematurity of strike. So prematurity of strike is the way that our teeth are incredibly sensitive to something that's blocking the molar occlusion. And all of you have experienced this if you have any cavities whatsoever. If you are eating berries, let's say, even something like blueberries, where you get a tiny seed stuck like in between where there's a filling in the rest of your tooth, and it drives you crazy because you cannot do anything else until you get rid of that seed. So when a equine dental practitioner is working on the arcades of the mouth, they need to be able to make sure that there are no tiny little bits. They could even be 1/2 millimeter that are sticking and keeping the jaws from moving smoothly, the teeth from moving smoothly together. So the fine finish is done by hand. And let's talk about the toolkit here. Let me go back to this for a second. So after you do, so Lee and the other dentists who I work with use a combination of power tools and hand tools to do what they need to do. There is no glory in using only hand tools. There is a considerable disadvantage to not using every tool that you can. The tooth fairies, as we say, are people who have a belief system that if you're a real horseman, that you don't need to sedate the horse because you have good horse handling skills, and you don't need to use power tools because power tools hurt the horse and you can do everything you need to do by hand. Well, it's just not true. As I explained, to sedate the horse allows you to assess the function of the jaw in a way that no matter how good a horse handler you are, you cannot get the horse to tell you if they have a prematurity of strike. You can only assess it using your manual skills. So like when you go to the human dentist and they say, after your dentist does the filling and he puts a piece of carbon paper in the mouth and says, okay, tap on that, grind a little bit. Then he looks in the carbon paper and he looks in the mouth and he sees where it's marked as high. That is how your dentist can figure out where there's prematurity of strike. You can't do that for the horse. You can't get the horse to tap on some carbon paper. So you have to be smart enough to figure out where it is yourself. What you see pictured here is Liam Kelly. He's one of the other dentists we work with. This is his tool set. And what you see here is this is a bunch of hand tools for extractions. And there are floats that go along with the power tools. There are a lot of hand floats. There's a system that takes the tooth dust away. There's all kinds of stuff here, and this is about $40,000 worth of equipment. And there is no substitute for having all the right tools for the right job. Insisting on using only hand floats means that you are not going to be able to get a good assessment of how the entire mouth is moving together, and you're not going to be able to reach the back teeth, because in order for a file to cut, they need to get behind it. And so some of these people, they make these special side-to-side files, they're unwieldy, and it is not a fine job. So using power tools appropriately is absolutely the best way to go. But again, you need to be a skilled practitioner. So you don't want to just indiscriminately use a lot of power. You want to use the right tool for the job. The dentists I work with, sometimes they're using little rotary burrs. Sometimes they're using a what looks like a traditional hand float that's on a reciprocating saw. Sometimes they're using the eponymous power float, which is essentially a circulating disc of a file. And you need to look at the individual malocclusions in the mouth. So let's say you see that there's a step where there's a big difference in length, and you need to smooth that out. But then you also need to feel how the entire mouth is working together. So the very last part of the finish is taking a standard hand float and running it back and forth and making sure that there is no place where it's catching. And then they take a tiny little soft file, one that's really, really fine, and make sure there are no sharp edges anywhere. So there is no benefit to avoiding using powerful tools. There's no benefit to avoiding sedation, and there's no benefit for avoiding using your eyes to help you with the job. So again, this is like a mythology of a certain kind of equine dentist that, oh no, we use knee pads on the floor and we never open the horse's mouth because that hurts. And we only use hand floats and do it by feel only. It's like, I'm sorry, if you have senses, you need to use them all. So you're going to use the sense of touch, but you're also going to use the sense of sight and of sound. Sound is really important in assessing the occlusion. So the final part of the talk is going to be how this all goes together for posture and performance. Remember this guy. So we are looking at a crooked mouth that leads to a crooked body. Asymmetry is never isolated to the mouth. When you have a diagonal pattern in the incisors, you're going to have a diagonal pattern in the rest of the mouth. So you see that the crown height is very different. This is long and this is much shorter. And here we have the twisted diagonal mouth. It's never just disappears where it is, always everything is stuck together really well. On the horse with the funky mouth that we've been looking at, this is his shoulders, and we see a lot of asymmetry there. And we see that his hoof heights are dramatically different. Both hoof capsules are long with underrun heels, but the left front, which remember his jaw goes off to the left, so that's his heavy weight bearing foot, that is a low underrun heel, and the right front is an upright underrun heel. And you can't stop overweighting that foot if the jaw is going off to the left. So you cannot fix this horse permanently. You can do a lot to maintain and moderate this tendency, but without fixing the mouth, you cannot fix the feet permanently. So I think I told you that when we bought this skull from Skulls Unlimited, I wanted to get the best and most beautiful skull. And they sent me some pictures, and I said, yeah, this one looks great. And then I lifted it out of the box and saw this. And this skull is really, really asymmetric. So if we look at from the front here, you not only see how the teeth are really asymmetric, but see this triangle that is made by the two parts of the jaw? It is not an equal triangle. It goes way out to the side here and is more vertical here. And every part of this horse is crooked. Look how the nose shifts off to our right when we look at this picture. And if we look at the back of the horse, we also see the same kinds of things. This is where the first bone of the neck attaches to the skull. And these are both, they're asymmetrical side to side and front to back. So there's profound asymmetry in the way that this horse's head was stuck onto their neck. And you can see how this plane here is very different than this plane here. So everything about this horse is profoundly crooked. And because the way it's stuck onto its neck is crooked, it's going to be crooked through the rest of its body because there's going to be differing fascial tension because of that skew that's in how the skull is put on. So Dr. Shoemaker, I'd been teaching with the skulls for a couple of years, and she goes, oh, look, he got kicked in the face. And if you look at the skull from above, you see this huge divot here. And this is the source of the asymmetry in this horse's skull. So you see the forensic evidence here. Right here is where the orbit should be nice and smooth. And instead, there's a big divot out of the orbit. And everything in that face got pushed to the side because the bones of the skull are not actually fused, especially in a young horse. The bones of the skull are suture joints that actually move a little bit. So when a lot of pressure, enough pressure to like take out a chunk of bone, pushed that horse's face to the side, the whole horse became asymmetrical and crooked. So what happens with that? When you have a crooked horse, you can get crooked teeth, or when you have a crooked teeth, you can get a crooked horse. So there are all kinds of whole body issues that can affect the dentition. Obviously, the temporomandibular joints can dysfunction. You can have upper cervical problems in the pole. You can have problems with stance and weight bearing and how you carry your feet. You can have problems with head carriage. You can have deviations in the spine, limb injuries or asymmetries, muscle hypertrophy or atrophy, and pelvic rotation. All of these things can affect how the jaw is relating to the upper skull. But you could also have local issues that affect the rest of the body. So you can have injury to the skull, the way we saw in that horse. We can have a mismatch of the lateral occlusion and the front to back occlusion. And they don't even have to be large to affect the movement of the jaw. And there are many bite deficiencies that would be incompatible with life in the wild, but because we take care of our horses and feed them whatever they need, they end up surviving. So if we look at the whole horse, what we want to see is that everything is aligned. So these schematics are looking at the head as this circle, and then we have the vertebrae, and they should be all lined up. And the mandible, which is the jaw, should be lined up with the head, the maxilla. And we see here marked, these circles are the TMJs. And this is the center midline where we want to see those teeth, the center teeth of the top and the center teeth of the bottom line up. So what happens when the jaw goes off to the side? So if this jaw has come off to the side, then we end up with more pressure on this TMJ than this TMJ and compensation in the neck for keeping the head on straight. And if you end up, if we take it further back to the rest of the body, think about how the front legs and the hind legs are attached through all kinds of fascial connections, and they're all going up and down the spine. So if we take a symmetrical horse and make it crooked in the teeth, what we see is compensation through the entire body. So once the head is crooked and the teeth are malaligned, as in those diagonal patterns we've looked at over and over again, then everything else becomes crooked in the whole horse. So you can, this is the typical horse who gets an adjustment from a great chiropractor every month and does really well for about 2 weeks, and then they go back to being really crooked because the teeth will always reassert those changes because the proprioceptors are saying that we have to be off like this. So the horses that are not getting better over time you have to look further. You have to look in the mouth to see if the dentition is the cause of the asymmetry. And the horse will do everything they can to go straight down the road. So how do you go straight down the road if your body parts aren't straight? You have to compensate with muscle movement, and this creates soreness, fatigue, performance problems, and inability to perform complex movements. So you could have a horse who does really well until you get up to third level, and suddenly it's like, nope, I can't do a canter pirouette. And that's because they could compensate up to a point, but when you ask for a task that is too difficult, they go beyond the ability of their compensation to be symmetrical. So misalignment can cause postural changes, and postural changes can cause misalignment. It can go either way. But if you are in the process of helping a horse, whether you're a physiotherapist, a horse owner, a trainer, if you have the same problem recurring over and over again, it may be that the dentition is a key to getting that horse to be straight. You've got the best farrier, you've got the best physio, but the horse continues to be crooked. You need to find out who is the very best dentist you can find and what is their training, and make sure that they really know what they're doing, and see what's going on in your horse's mouth. And I'll talk to you in a minute about what you can do to look and see whether there are obvious problems. Which isn't to say that if you don't see obvious problems, there aren't any, but it's a matter of what you can see easily on the surface. So the takeaways that you need to have is that jaw position and dental occlusion are going to affect posture and performance, especially in domestic horses where they don't get enough exercise and don't get a normal diet to straighten themselves out. All horses need accurate occlusal equilibration. So there's no such thing as a broodmare float, because broodmare is also going to need to stand up straight to carry that foal. Unlike just floating or taking off the sharp points, occlusal equilibration requires extensive training with a master. The more training, the better. The more experience, the better. Tools are only as good as the operator. So you don't make a judgment about whether the dentist that you choose is good based on whether or not they use power tools. A good dentist will use all the tools they need to get the job done accurately and quickly. Sedation is absolutely necessary for accurate occlusal equilibration, because otherwise you cannot check the work to make sure that you have made the jaw functional and avoiding prematurity of strike. So if you want to check your favorite horse to see if you think there may be dental issues affecting their performance, you can get some really good clues by not going very deep into the mouth. So the incisors you can look at from the front and from the side. It's important to have the horse's head in a neutral position, which is to say the head kind of at the level of the withers, so not up in the air and not way down on the ground. So from the side, I mean, start with the left side because horses are used to being approached there. Just gently move the lips aside. Don't try to open their mouth. Just move the lips aside and look and see how those teeth are meeting side to side. Get a mental picture of that occlusal plane, like if you put that credit card between their teeth, and look to see whether that visual axis between the teeth is going through the TMJ or coming up and coming out somewhere on the nose. So you do that on both sides, and then I always kneel down on the floor or bend over if I'm trying to look from the front. So from the front, again, just move the lips a little bit. Don't get the horse to fight you. Just move the lips out of the way and look to see whether the center of the top arcade is matching the center of the bottom arcade, and whether you see that the teeth all look pretty much the same length. So that can give you a picture of the most dramatic kinds of incisor problems. And if your horse has incisor malocclusions, they probably have molar malocclusions. If your horse doesn't have incisor malocclusions, they may still have molar malocclusions, but it at least gives you an idea. Then the other thing that you look at that is more of a molar thing is the TMJs. So the TMJ on the horse is, let me find a picture. So the TMJ is just past the eye, right? So you go from the middle of the eye and up from the curve of the jaw. So the intersection of the line of the eye to the jaw is where the TMJ is, and the bones actually stick out a little bit on the surface there. So you can lay your hands in there and just kind of wiggle, wiggle, wiggle and see what the horse does. If it's exquisitely painful, they'll move away. They'll give you the stink eye. Sometimes if it's just a little bit painful, they'll just kind of get this kind of squinty, far off look in their eye. So check it on both sides. And if the horse just doesn't blink an eye, doesn't do anything, then probably there's no significant TMJ pain. I hope that this tour through dentition and the body was helpful to you. And we're going to go into a live question and answer section and write down your questions, and hopefully we can get to most of them during the session. Thanks for listening, and I'll talk to you soon.